What it do? This is the Brothers on Books podcast, where we find great books that will give you real value and actionable steps and have fun in the process. Please reach out to us at brothersonbooks@gmail.com for any book recommendation, or if you would like to be a guest host for a particular book you have in mind. A great review or rating on whichever platform you're listening to would be greatly appreciated. Lastly, if you can think of any friend, family member, or coworker that might like this episode, please pass it along. And remember, if it's a dark and stormy night and you need a drink to warm the depths of your hearts, we at the Brothers on Books go with Encha Matcha, the best matcha for the best brothers. And now our listeners can get 10% off when they use the link or the coupon code that can be found in the show notes. I'm Alex Alwell, and with me as always is my brother Jack Alwell. Jack, how you doing?
I'm doing great, Al. How are you this fine evening?
Yeah, and we record just like we release. We record on Sunday, and Sunday I had a relaxing Sunday. I did some hot yoga. I started doing hot yoga. I have to say I feel a lot fresher, more flexible
There
after
you
those
go.
events, even though during it I often feel like I think I'm gonna maybe pass out at some points, but feels good after.
How hot does the room get?
I would guess around 95, but I'm not sure.
Okay. Okay.
So Jack, we're doing a book you chose, Follow the Science by Sharyl Attkisson. I guess what made you choose this book?
After reading the Stiglitz book that you picked out, Road to Freedom, there was a segment on big pharma and patents. So I was interested once you brought that up, and I wanted to dig a little deeper on that topic. Now, this book, unfortunately, didn't get into patents at all. But if we end up getting Sharyl on the show, I would love to bring up that talking point with her. But I thought it would be interesting to see more on some of the incentives that are currently in the system and how we should be thinking about things as we, navigate through our lives. So that's why I chose the book.
Yeah. How did you come across, I guess, how did you come across it? Were you searching this out or?
I was not. I so during the book draft, all my books were current affairs, and I kid you not, they were all within like my wingspan on a bookshelf at Barnes and Noble in the current affairs section. So, follow the science was almost dead in the middle of the bookshelf. So I saw it, and yeah, that's how I picked it. I hadn't heard of it anywhere else, but it's on the shelf, and I've looked into her a little bit more since, and she seems like she's getting a lot of publicity now for this book.
Seems like I saw that as well. It does seem like she's getting quite a bit of publicity. Um,
Yeah, so why don't we start with the very first chapter? She talks about how she even got into this. Now, she's an investigative journalist, and it sounded like she was in the DC area on 9/11, and that's kind of what got her down the rabbit hole. Like, so after the 9/11 attacks, they thought smallpox could be considered a potential bioweapon. And I have in my notes that that vaccination ended in 1972, but they wanted to basically restart the vaccine program on that because they thought it could be used as a bioweapon. So I guess
Measles, this
she
is correct.
what's that?
Measles, this is.
Is it measles or small?
I think, oh, sorry, smallpox. Yeah.
Yeah. So I mean it's kind of interesting, and I think this gets her brain going because I mean what is the evidence that they would use smallpox, I guess, as the bioweapon amongst any other number of things, I guess, but maybe I just don't know. And I think anthrax around that same time was also a talking point. Um, but basically, they're trying to weigh the risks between the possible side effects of reintroducing this vaccine and the unknown, I guess, effect of a terrorist using smallpox.
Well, I think just just a side note, I think the reason they thought smallpox could be used as a bioweapon is because of how transmissible it is.
Okay.
And I went back and I'm just reading on literally page 3. It's one of the most virulent diseases known to mankind.
Okay.
Um, Easily transmitted through droplets coughed or sneezed in the air. If people touch something and like an infected person, they can get poxes, even if it's the bedding. So that's like pretty transmissible. Um,
Hmm.
Probably why they would think about it. I think
But
so. There was
I guess what, so yeah, I mean, I'm not, I don't remember exactly what she said on this, but like when I remember now looking back at my notes, I guess I would be wondering why amongst all things that would be the thing that they come to. Like this is like the thing the terrorists could use. Well, they could use tons of stuff. They could, I mean, fly more planes and buildings. They could,
oh, you mean as potential terrorist attacks?
correct. Yeah.
Okay. So you're asking why did they think that there could be a potential bioweapon?
Yeah, is that part of the narrative? Is I guess what made her go down the rabbit hole that she kind of questioned, like, okay, like are they trying? And there's that quote, like, never let a good crisis go to waste. So I kind of it would be interesting to ask her what was exactly going through her mind.
Well,
Um,
I mean, she personally is reporting on this, so I would imagine that they probably were worried about a lot of other possible terrorist attacks, right?
hmm
But we're just getting her subsection, which is on essentially diseases.
hmm yeah.
So I mean, if I guess what I'm gathering from this book is that if you were to choose a disease to use as a bioweapon, smallpox would be a front runner.
Okay.
I mean, that's just what I'm gathering.
Uh-huh.
The other sort
Um,
of interesting story uh, that they planned, what was it? Uh, First shots will go out to 500,000 military troops and then 450,000 frontline healthcare workers.
mhm.
That was the initial goals for this vaccine rollout.
Yep, and they were using the troops as basically guinea pigs.
Guinea
Now,
pig.
she did bring up the point the military doesn't care what shots the people have already gotten. They just inject and they do not keep records. She made a point on that. But also they stopped that vaccine program at like I think it was 35,000 workers. Um because I think there was negative side effects.
Yeah, so this is just page 5. The smallpox vaccine has a higher rate of serious side effects than routine vaccinations. Estimated that out of every million people who get the shot, at least 1 to 3 of them will die. That could translate to hundreds of deaths and thousands of life-threatening illnesses caused by the vaccine. The vaccine actually makes some people contagious with smallpox for a time. Smallpox vaccination can be effective after exposure, which reduces the need to pre-vaccinate millions.
Mhm. And then I guess that second point that you mentioned that they could get the vaccine after they got it, I mean that would lead one to question why don't they just hold off and if you actually get it, then give the vaccine? Or is I or at least that's what I believe she said something to that effect, but maybe it's
No,
hard to
I think that
detect.
means smallpox vaccination can be effective after exposure. Uh, I think means that essentially once you're exposed to smallpox, you're immune. Isn't that like just isn't what she's saying that you're building immunity through just getting exposed?
No, I thought it means if you get exposed and then you get the vaccine, it can still be effective at combating it.
Oh, okay, I understand what you're saying. Yeah, yes,
So
I
yeah,
think you're
I
correct.
guess I don't know. Anything else on I guess yeah, we just wanted to give kind of an overview of like where she's coming from, how she got started on this. But it's yeah, it's an interesting beginning to her trip down like vaccines and big pharma. Um,
So this is like, I guess in the initial thing, I don't know. Did you ever listen to the Kennedy interview on Joe Rogan?
No.
So that would have come out. I mean, she talks about Kennedy a lot in the essentially back half of this book. And she in that interview, he brings up a real lot of points. And I remember I had an ex-girlfriend who used to bring up a real lot of points on this topic. Uh,
You mean
that sort of tied
anti-vaccine,
into
right?
what this say again?
You just mean anti-vaccine or like,
Not anti-vaccine, that there are just a lot of side effects
hmm.
associated with vaccine, like vaccine giving vaccines that are not talked about.
Yeah.
And that was essentially what I remember from the Kennedy interview with Rogan. He was saying that a lot of these side effects are brushed under the rug, or they're attributed to other factors. And that's essentially what she's saying here. Page 6, I cover an expanding array of medical issues and scientific scandals. The actual number of injuries from vaccines or other medicine is accepted to be manyfold higher than what gets officially reported. And, I work I obviously work, well, you know this, but I work for a pharmaceutical company. Uh, And I feel like we talk about toxin safety, I feel like all the time. That is the main emphasis on what we're talking about when we're making things. I mean, tox safety and then like obviously efficacy, like does it work? Those are the main points. But uh, there's just like I feel like I was sort of bringing this up. I hear about side effects of drugs a lot. I don't feel like I ever really hear about side effects of vaccines. I don't know. I guess sort of interested in your thoughts on that.
Right. I don't either. Yeah. And I think, and she alludes, I mean, she talks about it a lot in the other, I don't know if we're going to get into this, but there's a separate court for claims against vaccines um, which is interesting because I guess the vaccine companies at some point said, we don't want the liability. We're going to just stop making the drug if we're going to keep getting sued over some of the side effects that may or may not be associated with the vaccine.
Yeah, that was said, and
Um,
I don't remember the exact terminology, but I felt like the vaccine companies for COVID almost had immunity.
yeah, that's what it seems like. And
So I mean, obviously, I don't think that's right.
and
Um,
they also talk. I mean, we'll probably get into this, but there seemed to be success on some of these other drugs that doctors were prescribing, but a lot of the government people seem to want to push them or smear them or say like you can't use these things, these treatments because we want these other treatments to get developed. And it seems like this is, part of crony capitalism that some of the companies were that there's I guess just follow the money and there's a lot of money to be made in producing all these vaccines and having people take them.
Yeah, I mean that's true. I didn't go back and read the studies about you're talking about ivermectin and hydroxychloroquine.
Yeah.
Uh, so I didn't read to see the studies if they actually were potentially more like better. They had better efficacy, I guess, than
Well,
the
it's just
eventual vaccines. But
yeah, I mean, onto the how do you say it? Hydrochloroquine?
I think it's hydroxychloroquine.
Okay, chloroquine. Hydroxychloroquine. I mean, the thing that she brought up on that is that it was almost like the medicine is getting politicized because she brought up the left um
Well, that was
was
true of both of them.
remdesivir that they were
Yeah.
for that and the right was trying to push this hydroxychloroquine um and they were trying it she was saying they were trying to use that to demonize Trump when he was saying this maybe should be looked into.
Yeah, I mean, like she paints a narrative here that
Uh-huh.
uh she's clearly, in my opinion, she's trying to paint a picture that pharmaceutical companies are trying to dictate essentially politics to get more of their drugs bought. I have I have no idea if hydroxychloroquine was effective against COVID. Uh, what she is saying is that that should be an anti-malaria drug that has gone through studies and is, I would assume, a generic, so it can be made very cheaply. Uh, that's all true. If if they Trump's statement, I think she even quotes him, was something along the lines of, "This is approved and safe. I don't know if it will work. What's the harm in trying?" So I guess there is some validity to that. If you trust the FDA trials that the drug's been approved, so it has some level of safety. Uh, I guess I don't really know what the harm in trying is.
Hmm.
Uh,
Yeah, and then the ivermectin, I mean, just have a note that it looks like by November 21, there was over 377,000 prescriptions per month on that ivermectin. And basically she was just saying the CDC and FDA were making crazy smears against it.
yeah, I mean that's also sort of silly to me. I mean, ivermectin, the discovery of ivermectin won the Nobel Prize in 2015 in physiology medicine.
hmm
And CNN, I mean, reportedly, Rogan took ivermectin, and then CNN was telling him, like, the stuff about stop taking stuff for horses
hmm
is, obviously there are like it's formulated for humans as well. Like, this is just kind of silly. But
hmm
yet again, I don't know. And I mean, one of my main takeaways of this book is, like, how do you know what's true? So, like, how I feel like with the ivermectin, I at least remember listening to someone talk about a study that showed ivermectin had no efficacy against COVID. Uh, but
Okay.
I guess her point is, you know, I feel like she's kind of painting this picture that all the people doing these studies are paid off by pharmaceutical companies.
Well, I think I don't know. I mean, I mean, there's definitely a lot of examples she gives where one would think that. Um,
Right. Yeah,
I guess she's kind of just saying she feels like it should be like a town square where everyone can raise their opinions and then we can let science duke it out. But it's not, it's like one side's kind of just putting dollars and dollars against it to like smear, just these like smearing campaigns, where we're not actually looking at what the trials show, what the results show, like proper science.
Yeah, yeah. I
So,
mean, I agree with it. I mean,
um,
there's a massive problem. Even, I guess, I worked for a long time in basic science. There's a massive problem with fraudulent. I mean, she talks about peer-reviewed studies, peer-reviewed papers. There's a massive problem with scientific literature, and that it's not. I mean, I work in chemistry. Even chemistry research is not reproducible a lot of the time. And the more you go towards life, the less reproducible studies tend to be, just because there's such difference, even amongst humans. Like, when you're doing studies on humans, the differences between humans are so great.
mhm,
You have vast differences. So, like, a
okay.
lot of times the studies are not reproducible. Um,
You just mean because there's so much variation from human to human? But even in or are you saying because it's hard to do it on a big group of people or
so, like, the metabolism of a drug, like, happens. Your microbiome in your gut is filled with bacteria. So
hmm
bacteria can alter how things are metabolized. This is why there's variation in how people react to drugs a lot of times.
hmm
So, like, why would someone have an adverse reaction to, drug A when person B is totally fine?
hmm
And yeah, it comes down to some of it's genetic, some of it's, Some of it's genetic, some of it can be your microbiome, like your gut bacteria. Just things can metabolize differently. They can change the drug in a way that makes it toxic. They can change the drug in a way that keeps it, potent and it does what it wants. But it's very difficult to get the same, not necessarily the same result, but I mean, not always drastically different results, but it's more variables versus when you just have stuff in a flask,
Hmm.
you're doing a chemistry reaction.
Hmm.
Like if you go
Yeah.
and take baking soda and you put it in vinegar, you know exactly what's going to happen every single time because you know exactly what you have. But one variable, human to human, the humans are different on the inside, I
Hmm.
guess is what I'm saying.
Yeah, and then also I mean to her point later on in the book that some of the studies, I don't know what your experience has been, but like some of these studies don't really go that long. So like if I mean there's obviously a possibility something doesn't show up until years down the road. And that was when she talked about like, Viagra was causing blindness in a certain percentage of men. Um, and there are these databases,
Not deafness as well.
deafness as well.
I think she said deafness as
Okay.
well.
But there's apparently a database, and I think it's let me look at it. MedWatch, where you can report adverse effects for certain, I guess, medications and vaccines. And then there's a vaccine adverse event reporting system. And they basically, if you think something might be related to a medication or a vaccine you take, you can go and input that. And I guess these institutions will sift through and figure out what's noise, what's not noise, and maybe on a longer time scale be able to put some things together where they then say like you might have, X% chance of developing this down the road. Um, but actually I wanted to talk because you brought up like the journals. Like I don't think I've really seen like any of these academic journals. Can you kind of describe like what they are and like how the institutions make money off them?
The journal?
Yeah.
Well, journals you have to pay to publish.
You have to pay?
Yeah, it's a magazine.
Really? So the authors are paying to be in the journal.
For most instances. I mean, there may be
Interesting.
some that just publish that I wouldn't know about. I know physics is really different. I think physics just does like open source stuff. But a lot of times you're essentially paying for publicity. Like you're paying to put your work out there in a
Uh-huh.
reputable journal.
Okay. Interesting.
Or I mean, you personally aren't, like probably the institution is.
Uh-huh.
But at the end of the
Okay.
day, it is a magazine. I think that's part of the reason why uh I mean, I'm gonna blank on the numbers. I know some foreign institutions I've heard they will pay, or I've actually heard of governments paying their scientists for numbers of publications they get out into some prestige journals. So this
Mm-hmm.
causes a lot of, it causes a lot of fraud in
Mm-hmm.
the journals because you create a massive incentive to just publish essentially fictitious work. I'm also at this point, I'm just speaking about chemistry, like because
Uh-huh.
that's what I really have experience with.
Mm-hmm.
Uh, I mean, whenever I wanted to alienate my boss, I would go tell him I would go tell him I found some Chinese pen and I was going to follow their procedure because it almost never worked. Um, or there's just so much fraught publications from Chinese groups is because the Chinese government, from what I've been told, would pay the essentially the researchers for all their publications.
They would pay the researchers for their publications.
The government, yeah. This is what I've
And
been
so
told.
so these journals are international. It's not just like an American journal. It's
Yeah, I mean, there's a Journal of American Chemical Society, JACS. That's a pretty common one. There's
uh-huh.
also, European journals. Angewandte is probably the biggest European journal that I used to read. And then there's, journals of like Asian chemistry as well. I mean, a lot
Huh.
of my thesis was based off of a paper that did work from a group in India. It was published in I'm blanking on its name, some Asian journal.
Huh. Okay. Um, okay. Well, that's interesting.
But like, I mean, I feel like one of the big issues I sort of had with her is she was making it sound like, well, one, all these drug companies are one just like out to sort of lie and cheat and get their drugs into the market. And I would say that's just not, and kind of like hide side effects.
Uh-huh.
And, I'm sure like, I mean, she obviously pointed out a lot of examples, but I've worked on a decent amount of, I mean, even when I was in academics, I worked on some like drug development programs and in my current company, I feel like toxin safety is like the thing we talk about most. And if we can't mitigate toxin safety, I've seen a lot of programs essentially killed for those issues.
When you saying tox, what is tox?
Toxicity.
Ah, okay.
So like if you have a drug that's toxic, like you can't put it in people. That's my point. Like
Uh-huh.
she's sort of, I mean, yes, there are instances where I think some of these companies like they probably do have side effects and they do brush them under the rug.
Uh-huh.
But sort of to your one of your initial points, like you can't possibly test for everything.
Uh-huh.
There's a standard that you test for in terms of safety, and if something happens after that and you've sold the drug, I could imagine you probably don't want to be held liable for it. Yeah, but you have gone through. She brought up one really, I thought, bad example where this company was like shifting some of their, I think, kidney damage that was being found. Uh, Let me see. Yeah, one is to bury them. That happened with the diabetes drug Rezulin. It's taken off the market in March 2000 due to reports of liver failures. Its maker, Warner Lambert, ultimately credited or blamed my CBS investigations for getting the drug removed. And she later goes on to talk about uh, she was interviewing someone with the FDA about how he missed it. And he points out that they were hiding all the liver damage under different markers.
Yeah,
Uh,
they were like splitting the data up into groups so it
right.
kind of hides the
But
classification of yeah.
yeah, that's obvious. In my opinion, that's obviously fraud, and they should be sued and they should be
Uh-huh.
held accountable. But I would say in most instances, I don't think that's the case. I
Well, like
think
what do you
most,
uh-huh. Go ahead. Sorry.
I would say most, from my experience, most side effects are things that, uh, when serious side effects are seen, either they're marked or labeled depending on the drug, or they're killed.
Mm-hmm.
Or you go back and you try and develop the drug away from that.
Mm-hmm. What did you think of? I'm forgetting the name of the drug, but there was a drug for Alzheimer's. Um, it was Biogen, and basically, they like halted the clinical trials. And then 9 months later, they filed for FDA approval, and they hadn't really done anything extra. And
Yeah, I
this,
remember I remember in real time when that was happening, and I remember
uh-huh,
thinking it was silly, and they were just. I think even the one of the investigators said is they're just trying to sell hope.
uh-huh.
And that's
Well,
that's
I guess and that's part of the like understanding the incentive structure because I mean, I've notes Biogen planned to charge 56,000 a year. And that this, because it's like Alzheimer's, it is like, for old people, which would be covered by Medicare. So it seems to me the incentive structure is the the pharma companies would be incentivized to do things specifically for old people and to be covered by Medicare, where it's borne by the taxpayers. Um, but I guess this dynamic where there's a certain section of the population that has, socialized medicine but everyone's paying for it. That seems to be like, I guess, like a flaw in the incentive structure, I guess. Or like there's like there's something to be said about, I guess, the company's trying to cherry pick and like you said, like you could just show like, oh yeah, it doesn't do harm, but it still might get approved, and then yeah, sell hope. But then they say like, oh well, it might extend life. It doesn't really, fix Alzheimer's or um so yeah, I guess in my mind, like, yeah, if you could get something, and that's like for anything, like government, like, I mean, if I wanted to, you know, like public education, like if I could get my curriculum put into public education, yeah, I'm gonna like go for that. Like anything where the government's like paying for, like if you can get into the government funding in some way, that seems to be a way to make a lot of money, I guess is what I'm saying.
Sure. But I guess in that particular example, didn't they not pay? Because didn't they then have the price and then still they weren't willing to pay for it?
I thought that that was the one where I think the FDA advisors actually denied it, but then the FDA
Then
still approved it.
still approved it, right?
It's
That
like
was silly.
it's like crazy. Like, and that really makes you question, like, do we have faith in this system? Like, if the expert advisors are saying no and it's still getting approved, well, like, what is the point of the expert advisors?
Yeah, I thought that was right. I thought they were just trying to give. I feel like part of it's almost political. Like so much
But
money. I mean, that was from Biogen, but like so much money has gone into research, and essentially there's nothing, right? There's no end product, and I feel like there's a push to get, maybe it's just like a push to get something on the market to say like, hey, look, we actually did something.
yeah, I mean, I guess that's like saying like, yeah, I sunk, 20 years trying to become a soccer player and I have nothing to show. Like, something to that effect, or something similar to like an individual. Like there's no guarantees any your hard work is going to pay off in any meaningful way.
Sure,
um
sure.
and so I guess I did want to bring up this question. So like if we got rid of Medicare, do you think the drug scene would be a lot different?
I have uh
Like, do you think there would be less targeting of the older demographic, like things catering to, because I guess,
well, I don't
uh-huh.
necessarily think things cater to the older demographic that much. I think most diseases just pop up in the older demographic.
Hmm. But do you think it would be as strong of an incentive to make the drugs if Medicare did not exist?
I honestly have no idea.
Uh-huh. Okay, I mean, I was just curious if you had a thought, like, because yeah, I mean, that's kind of what I was thinking as she was writing this, because to me it seemed like she was saying that companies are going out of their way to almost target this portion of the population or this system that's in place, like Medicare. And this goes back to the when we read Never Pay the First Bill. Why are the people on Medicare paying? There's certain treatments where we as younger people are paying, five, six, seven times the Medicare rates.
Right, but
Um,
like I guess doesn't that sort of run contrary to your what you just said? Then why wouldn't you pay? Well, if you're
I guess my
paying,
point is the younger people are kind of subsidizing the older people.
okay,
So that's that I guess that's what I was thinking with that. Um, and if yeah, I guess I'll just leave it at that. I don't really know. I was just throwing it out there in case. Um, um, so let's go into. I mean, one thing that she brought up that was interesting and I didn't really know about, and I do notice it when I go to Austria and Europe that you don't really see medication ads all over like you do here. And she was bringing up the point. Let's see, this was TV drug ads began in 1997, and by 2020, the pharma industry accounted for 75% of all televised ad spending in the US. That is
Yeah.
wild.
I mean, it was interesting to read her talk about her her producers giving her pushback for wanting to publish these stories about essentially vaccine and drug side effects because I guess the pharmaceutical companies at the time, or I'm assuming still are the major, ad revenue that they get. So that was interesting, I
Yeah, because
guess.
it's this weird dynamic where the person that's basically paying your paycheck, you want to, freely criticize, but if you criticize them, what happens to your paycheck? If then they pull their ad spending, it's this weird dynamic, and I mean, she brings up a lot of well, pharma ads have been banned in many countries. So that I mean, that was interesting to think about. It's something I guess I notice, but I didn't really ever think too much of it.
I mean, but do you not think that if pharmaceutical companies were banned from I actually don't even know if we run any ads, but do you think if pharmaceutical companies were banned from running ads that other companies just want to take their place?
Well, I think
Probably I'm guessing a lesser rate.
I guess the rates would go down, right?
Right.
Because otherwise they wouldn't have such a high percentage because they're accepting that ad money. Um, I'm kind of curious because I remember when we were young, I do remember seeing cigarette ads everywhere. Like, you see the Camel on the billboards, and like they got rid of that. Um, I'm kind of curious what that revenue was for some of these media or like billboard companies before that happened. Um, but yeah, it's just I mean, yeah, someone would step up and get that ad space, but do I think that the revenue would be as high? No, I don't.
Yeah, I
Um,
mean, I guess almost yeah, I think that's probably true.
um,
The other thing I thought that was, I mean, sort of like the other big issue she brought up was all these conflicts of interest
mhm,
with all these independent, like quote unquote, independent doctors that are paid for these testimonials,
mhm.
or essentially are these people that are billed. And I do think I do find this somewhat malicious. These that are billed as independent third parties are actually on payrolls.
Yeah.
Uh, so like, and that's not to say like I don't. I mean, I feel like you also know a lot of doctors. I know a lot of doctors. Most of them I feel have a certain level of integrity. Uh, at least that I feel comfortable saying the ones that I know and interact with have a certain level of integrity that I don't think they would lie, like they would knowingly lie to patients. So if some of my doctor friends told me they were like I should take a drug, um, I would believe them, even if they were being paid by the company. Like I think they would still act in my best interest. But I do find it weird that they
I
don't
mean,
disclose
uh-huh,
the fact that they are taking money.
uh-huh. I mean, one thing I'll say, and I think this is kind of linked with the TV ads, is that sometimes, and I have a lot of doctor friends, and they have said that, sometimes sometimes a patient will come in and the doctor will be thinking, just going to the gym might be the best thing for this person, but this person keeps bringing up this drug that they've seen and that they want. And it's almost like the patient is like putting it on and like, well, like it is supposed to be for this reason. Um, and like and yeah, that dynamic is weird. And I would agree that I think most doctors have good intentions, and the first rule is like do no harm.
Yeah,
Um,
the can't pick up or the
yeah, but I mean, there's a lot of these weird incentives, like with the drug companies, putting on lunches. A lot of the medical school books are even written by some of the drug companies they brought up in this book. Um, and it's almost like the doctors have become just this extension of the pharma industry where they're just, and it's hard for the doctors to, do analysis on every single drug or every single thing that comes out. They're kind of just getting information, and you would like to think that everyone is operating with integrity and has the patient in mind, but it doesn't seem like that's always the case.
I mean, like realistically, you can't be up to date.
Right.
I feel like
True.
on every single drug.
Yeah.
Um,
But it is kind of a weird like dynamic when the patients are bringing up drugs to the doctors like out of the blue. Like, oh, I saw, this drug on this ad and I think this will really help me. And it's exactly like, it says it'll do what I want it to do, basically. It'll solve my problem.
yeah, I mean,
Um,
I think in this sort of comes to one of the things. I think most doctors would agree with this statement that most people, if the drug is not life-saving, like I don't think if you have cancer, like I don't think going to the gym is going to cure your
right.
cancer.
Yeah, yeah.
I mean, living a healthier lifestyle will help you, but
I was talking more about like people that have like like psychiatrists, psychologists, like more,
antidepressants.
yeah, like depression type medicine, antidepressants.
Sure. Or something like high blood pressure or cholesterol. I think almost all, I would be hard pressed to find someone that said if you have any of the like high blood pressure, high cholesterol, changing your lifestyle would be much better than taking a drug.
Hmm.
But at the end of the day, it's very difficult to get people to change their lifestyles. Um,
Yeah,
and it's very easy to just take a pill. Like, I
yeah.
guess the point is if there are these side effects that aren't well known, uh, it's hard to make a accurate, I guess what I'm saying, it's hard to make an accurate decision as the person if of the risk reward benefit of what you're taking.
Yeah, absolutely. I mean, it makes me think of, and also like in terms of like combining certain medicines, Taleb had this quote, um, absence of proof is different than proof of absence. And it's basically to proceed with caution,
Absence of
eh,
evidence.
or same idea. Yeah. Um, right. Absence of proof. Um, and I think that's kind of I mean, that's how I would operate. I kind of lost my train of thought, but
Right. He also says that, if your medical disease is not life-threatening, you should not take a medicine and you should try and change your lifestyle.
mhm,
If what you have is life-threatening, you should essentially do anything or try anything to help yourself.
mhm.
Um, which is, I think, sort of how I kind of live. I don't know. I feel like I mean, you probably intuitively do it as well. It's not good. Like, yeah, just like you said, like you don't want to be over there taking like 15 different pills every day, because you don't know. There's no
Mhm.
way one of my initial points, like I don't think these drugs are, made with obviously the intention of hurting people. I don't think it's malicious. I think companies are trying to help, but there are a lot of things that you have prolonged use of something, a lot of these weird things can pop up that they have no way of knowing about. So it's
Right.
better
Yeah.
just not to even put yourself in the situation.
Right. Yeah. And I mean, some of her points are, yeah, some of the studies to get FDA approval are not that long. So you don't really know long-term effects on even just one single drug. So, um, but on to like,
Well,
I
hold on.
guess,
I have just one last anecdote about the conflicts of interest.
sure.
I remember a long,
I want to bring up the statin thing after what your point.
this is just sort of like a story. I remember sort of the same. I remember when well, you were a vegan, weren't you, for a while?
For a little bit, yeah, like a half a year
Yeah.
or something.
Yeah, when I was a vegetarian, I remember I remember an ex-girlfriend like telling me about like all like going through this like food science papers, and like literally every article was written by the producers of the food. It was sort of the same thing. It's like, um, it was like these articles that said eggs are healthy for you, or like beef is good for you. And they're
Hmm.
all written by cattle companies and like, egg companies.
Hmm.
So it's like, do you really believe that? And I'm
Hmm.
like, I don't know. I feel like people have eaten eggs for a long time, but so it's just sort of the point. Like it's hard to believe information coming at you when the authors of the information have an incentive for you to believe them, I guess.
Yeah. I mean, one of her points is just higher transparency. So if someone is, giving some sort of analysis, I mean, it's not to discredit the analysis, but if that person has a financial tie to a drug that will make money by selling this drug, you might want to at least have that in the back of your mind and figure out how much credit this should be given or just yeah, just think about it. Or like it should be more transparent in the source of the information, the people involved. Um, but I wanted to bring up,
Well, hold
yeah,
on, real quick. If nothing else, if you disclose it on the front end, if you're super open about it, people may say like, oh, well, of course you're saying that you're being paid by them,
uh-huh,
right? But if enough doctors come out and say like, oh, this is safe and effective, there's a limit to how many people you think are being bought off by like one company.
hmm,
But if you have one study where they don't say someone's being paid to give the study, and then later it comes out that they were paid, that immediately, I think I would have way more skepticism about that study
sure.
than 10 studies, because then it looks like they're trying to hide it.
Right. Yeah, yeah, absolutely. Um, I wanted to bring up this cholesterol conflicts where there was a panel that issued a guideline that our cholesterol levels need to be lower. And this basically lowered the healthy range. And because of that, there would be about 8 million people that would now not be in the healthy range and would require statins. Um, and seven of the eight panel members benefited from statin makers. And like when I read that, like, I mean, these are the types of stories that like I really like lose faith in the systems. Um, and it kind of made me think she didn't bring this up, but like with mental health now, I don't know if you know the company BetterHelp. I mean, I have no idea what their affiliate programs are, but I feel
Better
like
help.
every podcast now has an affiliate to BetterHelp. They're always like, talk to a psychiatrist, even if you're like healthy. And it used to be like mental health was like actually for people that were like seriously depressed. And now they've found a way to have, basically all customers because now it's not just if you're, mentally ill, you need a psychiatrist. Everyone should have a psychiatrist.
Or it's a
Um,
I think a lot of it's like a therapist. Like everyone should be in
therapist.
therapy.
Right. Yeah. And it's like to open up the customer pool. So like these types of schemes, I'm really turned off by when I hear things like this. Um, I don't know. Do you have any thoughts on this?
Yeah, I mean, they did. This is sort of a morbid example, but they did the same thing with mass shooting statistics. Mass shooting used to be defined as if six or more people were shot, and then
Hmm.
at some point they changed it to if four or more people were shot.
Hmm.
So then obviously it looks like the amount of shootings are going up, or mass shootings are going up because they changed the definition.
Interesting.
Uh,
Do you know what year that was?
no, I don't have the year off the top of my head.
Huh.
I just remember, I mean, I got that off a podcast like probably 4 years ago. So probably like, I don't know, 2012 or something.
Uh-huh.
Yet again,
Interesting.
I'm coming, that's just off the cuff.
No, no, that's
Yeah,
that's
that,
fine.
that stand thing's super annoying. But, yeah, I mean, maybe I'm just naive or maybe I'm optimistic. I like to think, uh, I like to think that, the doctors are not, um, lowering the requirements just because they'll make more money. Like I like to think that they
But I mean,
actually believe that
uh-huh.
that this is the healthy range that your cholesterol should be in. But I don't know, maybe I'm wrong. I
Well, here's a
do.
question. Here's a question. Do you think you could assemble, so like for cholesterol, for example, so this is saying eight of those members, so seven of them were directly linked with some of the statin makers. So do you think it was possible to assemble like eight independent people on
Yeah, I
this
mean,
topic?
she's not. I also don't think she was saying like how much the people like what their compensation is, how much they're being paid, or how they benefit. Like if you're giving like I know one of my buddies gives drug talks every once in a while, and I mean it's like every other month he goes and gives like a talk at a dinner, and he's told me he makes like 5 grand,
For
right?
one night?
Yeah,
That's a lot. Okay.
right, but that's probably not going to, as a doctor, that's probably not going to change. It's probably not going to like buy you in any meaningful way, I would say.
Okay.
But if you're like making, if your opinion is worth, changing policy where you're making hundreds of thousands of dollars, like, yeah, you
Oh,
understand what I'm saying? Like how much the people are getting paid, like has a bearing.
I just assumed when it said when the members benefited from the statin makers, I just assumed like they had like some sort of royalty or like share in the company.
Right. Sure, but I have no idea. I'm just saying, like, I agree, it should be disclosed, but I'm like the amount that they're getting paid, like, it doesn't necessarily mean that they're these corrupt people.
Uh-huh.
It looks weird that it's not disclosed. And
Right.
to the
I think that's the point. Like in a lot of other, like I think even a lot of like the big four, like the auditing firms, like they can't trade shares. But like there's, I mean that is a conflict of interest. I mean, it doesn't really matter what the amount is if they're benefiting somehow, even if it's a low dollar amount, I'd say there's still a conflict of interest.
Right, I agree. I think it should be disclosed.
Yeah.
I'm just saying it just doesn't necessarily mean that reducing the cholesterol levels is like medically wrong.
Uh-huh. I mean, don't you think they could find eight independent people though?
Yes,
So
absolutely.
so like yeah, I guess like if one thinks that, why is the government panel not independent? I mean it kind of I mean it bug I mean I'm sure like when we see like Nancy Pelosi's stock return, like it's the same idea. Like it's just like it's insider trading basically. I mean,
Yeah,
um
yeah, yeah. I agree with you. I
yeah.
agree. It's not right.
Um yeah, it's not right. Okay, should we get into some COVID shenanigans or COVID stuff?
Sure.
Um, okay. I guess the question is where to begin. Um, I mean, there was a lot of I don't know. Is there anything where you want to start on this? I mean,
I mean, I guess the gain of function research, I mean, it sort of goes into the same thing. I don't know if you want to explain what the gain of function.
actually, I don't really remember that. You wanna?
So it was a collaboration between us and China, essentially us and China, like Fauci's,
Oh, that was the Wuhan lab stuff.
yeah, the Wuhan
Okay.
lab. So like, did COVID come from a jump from what was initially reported, a jump from a bat in a wet market in China and Wuhan, or was it made in a lab
Mhm.
at this facility, and then was it accidentally released? Mm,
Yeah,
wish I wrote.
it sounded like the reports in this book were that basically this virus would have it seemed had to be like altered by humans. Um,
Yeah, so the evidence that she provides and the narrative that she says is that without a doubt this virus came from the lab in Wuhan that was funded by taxpayer dollars, and then essentially was one covered up, and people were told that it just jumped from bats, which is like common. That's common how viruses historically start. They jump from animals, and that essentially was covered up. And then the people reporting on it were all the people that were part of this institution that had made it, and then they were the ones dictating like what should be done going forward. And she makes a, I wish I could find the page. She in my mind, there was one paragraph where she makes to me what amounts to the claim that we essentially that they were altering the virus, the original coronavirus, with the expressed intent of building a vaccine to it to
mhm,
then sell. So to me, she's implying that we funded the creation of this virus to then have some people profit off the manufacture of the vaccine,
mhm,
which I have to say I found very preposterous.
mhm. Well, I think they also I don't know if they were trying to. I mean, it sounded like they wanted to create the vaccine in case this specific virus popped up. And they're like, that's how it was phrased. But like, but once again, like it's kind of like the smallpox vaccine thing. Like out of all the things, like you target this very specific thing that like, okay, yeah, I guess if that happens, you'll have a vaccine. But tons of other things could happen. But oh, and then this got out.
Right. I think it was, well, just to I don't, well, for one, I don't think that the government was trying to make a virus to profit off a vaccine.
Mhm,
Uh like I said, there could be any litany of other people doing different research about possible things. So
mhm,
it's not like out of the question to think you should be studying these viruses and how they could potentially mutate to infect humans. Like I don't think that's uh, unreasonable. I think it's silly to try and the way she's describing it. These researchers were going about trying to make viruses um, that would only infect bats, infect humans. And like, yeah, I don't get the point of that research. I don't understand why we would ever do that.
mhm. Yeah,
But
that's
I don't know. I don't think there's some like nefarious group out here that's like, okay, we're going to go make this virus and then infect everyone and we're going to have the vaccine ready. And then in a year, we're going to make billions of dollars.
mhm.
Like, I don't think that happened.
Yeah. Yeah, it's interesting. I mean, it kind of like you could I mean, you can kind of see like if they were to if they had the vaccine, that's why they would be then smearing all of these other ideas that come out where doctors saying, "Oh yeah, this has been pretty effective for my patients against COVID," and then big pharma saying, "No, no, no," or like, "No, you're not using those drugs or those treatments. You're only using this one." Um, but I hear you. It's yeah,
I mean,
it's
the evidence that the evidence I don't even know what the general consensus is anymore of like how the virus came to be.
hmm
I feel like I will say the evidence that she provided in the book, I feel like is pretty strong that it did come from the lab,
yeah.
at least all with all those, assuming her quotations and those emails that she's putting in the book. I didn't go check the emails that she got essentially subpoenaed or those quotes, but assuming that's all correct, then yeah, I think the evidence she's presenting is pretty strong that it did come from the lab.
hmm
Uh, but yet again, I don't think there's some like nefarious collusion that they were purposely releasing the uh, the virus to make money off of a vaccine.
hmm
It would also, why we're collaborating with China on something like this is also an interesting point because she brings up the fact that China has like a burgeoning like
Bioweapons.
bioweapons
Yeah.
category. And then at one point she said like Fauci was actually in charge of like the biodefense department or something. Do you remember exactly what that
It's
department was called?
I think isn't he the NIH, right? He's
Well, he was. That's what I thought, but she said, when you call him the director of, oh my God, the director of like the biodefense department, it like changes the connotation of how you see him.
right, right.
I mean, there was a ton of this like misreporting on these drugs, misreporting on some of these side effects that she calls these people out, and then nothing happens. Uh, all very aggravating.
Yeah. I mean, what do we
Uh,
think about even like just how like the narrative changed like with like what to do like this, stay at home um and vaccinated people do not carry the virus, they don't get sick. Because that was kind of the early narrative, and I have so like to the isolating at home being, what to do. There was the numbers came out of New York. Let's see here, May 2020, 2/3 of new COVID related admissions are people who had largely sheltered at home. And shouldn't this have alarmed the bells and then yet on the other flip side, like the beaches, the parks were shut down. I remember seeing basketball hoops like chained, like, and then another 21% of the hospitalized came from group living facilities, which were also, sheltering in place. And now the EPA is now stating being indoors rather than outdoors increases the risk of infection. Um, it's just, and then
I
on the
mean,
foul, yeah, I mean,
like in their defense, it is a disease that's transmissible through the air. So, it would make like intuitively, uh, even if you don't have what's the word I'm looking for, evidence for it, it would make sense that isolating yourself away from other people would probably protect you.
mhm.
So like just because the initial thesis is not right doesn't mean that
That
it just means that they're wrong.
that's true. But I don't know. This New York number, that was May 2020. So I remember going home and, sheltering in place basically, quote unquote, in, March 2020. So that was 2 months. So then after like these initial numbers came out, shouldn't they have immediately like altered and we could kind of go back to living normally?
Yeah,
Um,
I agree with you. I mean,
And
that was I remember in right when this started, I remember I was very uncomfortable. It was one of the first times I one of the first times I felt almost scared in a while, but I was scared that essentially there was going to be rioting. Uh,
rioting, how so?
I was just, people were like stockpiling everything. People were
Oh,
stockpiling canned food, rice, toilet paper. I remember thinking, man, people are going crazy. Like, I'm worried that people are going to like start rioting the street and destroy my house.
uh-huh.
That's what I remember thinking.
Okay.
From a safety perspective, I remember reading the excerpts of a study from like from Italy on the death statistics of who was dying from this.
Hmm.
And I remember immediately after reading that study, I did not think that I was personally at risk for COVID.
Hmm. I mean,
Uh,
onto the Italy thing. I mean, she mentioned how just blatant. I mean, this goes on to the point on like the tricks they were playing with the math, just on the reporting side. But the fatality rate is supposed to be the number of deaths over the number of infected people. Yet, I think in Italy, they were only using confirmed positive cases in the denominator. So the denominator was a lot less than it should have been. And of course, you're getting a high fatality number because of that. And that goes into the narrative on this is such a deadly thing for people. And I think there was something with the kids too, where I think this was the US though, where it said it was,
yeah,
man, I think it was like 4% of the fatalities were children, and it should have been like 0.04 or zero point 0.4. Let's see if I can find it.
I mean, she summarizes it up at some point where she essentially says that if you were under 50 and you were like
Right.
in relatively good shape, your likelihood of dying from COVID was like next to nothing.
Yeah, yeah, absolutely. And then yeah, and then let's see here. So I'm just looking through, and then there's also once again to your point on like changing definitions. They kept changing the definition of what fully vaccinated meant. At one point, it was after your second shot, and then they changed the definition to being after 2 weeks after your second shot. It's like, and she even, I remember when I was reading it, I was like, this is like 1984, where they're changing definitions and like, you know, the our speaking language. And she brought up 1984 actually. So that was yeah, interesting. Like this is like real time we're getting definitions changing.
And the other thing I remember she brought up was should you get vaccinated after you've had COVID?
Yeah.
Because I feel like there was a big push uh, to get people vaccinated, even if they had had it, which from conventional wisdom is sort of silly because even in the book she brings up like your natural immunity is probably greater from from the virus than from the vaccine, and then you're just exposing yourself to additional risks of
Hmm.
getting the vaccine.
Yeah, and this is back to the mental health, like with treating everyone should get therapy just because, like, well, what harm is it going to do? Everyone should get therapy, so like everyone should get the vaccine, and like that, it's just like increasing the customer pool. It just feels, I don't know. I don't know if you can hear it in my voice, but I was like upset when I was reading a lot of this stuff and like thinking back to when we were living through it because it really ruined a lot of my friendships. Because I remember I got it and I did not want to get the vaccine, and I felt so pressured to get the vaccine. I ended up getting it. Um, but I
Yeah, I
remember,
remember I felt the same way. I was essentially forced at I was more or less forced to get it to finish up my PhD.
yeah, it's just like, yeah, I don't know. And then This is along the counting or miscounting, but there was she followed some of the very small counties. There's this county in Colorado, Grand County, and the coroner said one of the guys that came in shot his wife and then killed himself. And then the next day, those people were counted as COVID deaths. And
Yeah.
this was just to, yeah, illustrate that there was some shenanigans going on with the counting.
Well, and she brings up like to find the true statistics, like you need to separate people that die of COVID versus people that died with COVID.
Yeah.
Like obviously these people, I don't even know if they had COVID, but the way she's telling the story, it makes it sound like everyone that if you had COVID when you died, you were considered a COVID fatality, even if you were essentially murdered.
Hmm. Yeah. Yeah, it's just and I don't know, it was interesting how she looked at the Amish and how they have historically not liked government. They haven't liked the health system, and they haven't liked public education. And she was talking about how they didn't want to stop seeing each other, and they also when they go to like church or when they during communion, they all drink from the same cup. So if one of them gets it, they're all getting it. And the Amish rejected the CDC approach, and they had similar death rates, but didn't shut down at all. So I guess we can say it was basically superior because they had the same, I guess, death toll, but they didn't shut down. So they weren't hindered as much economically. Um, and so I don't know. Any thoughts on the Amish, Al?
Well, so they then sort of the nefarious thing with that is they then a study was paid for, which essentially looked at one Amish community that had higher deaths
Yeah.
versus in Ohio versus the Amish community in Pennsylvania that had lower deaths.
Hmm.
So that material or that data was essentially massaged to make it look like they were like you needed. This is like when it becomes sort of. I do think this is sort of nefarious, is because
Yeah.
they're essentially purposely making the data look like it is bad, so people will
Right.
do what they want.
Yeah, they're cherry picking data. And I think that was also she mentioned it was Amish Mennonite, is it
Amish and
Mennonite?
Mennonites,
And
yeah,
I think she was saying the Mennonite actually were following the
right,
CDC. So
yes,
basically, at that point, they're like no different than any other normal person following the
yeah.
CDC. So, and then she tried to get a Freedom of Information Act to give her that Amish Mennonite study, like the reviewers, but I guess the report was that the reviewers are anonymous. So then at that point, like, okay, so the government's spending our money and then blocks the transparency on how things are conducted or getting spent. So that, I mean, like when I read these things, I'm obviously upset
Yep.
on how our government is spending our money. This, yeah, all
Yes,
goes back to trust.
rightfully so.
Yeah. Um, um, okay, so I guess more generally, there was an interesting thing in the book where she's asking AI questions about certain studies, and one of the studies was on that hydroxychloroquine.
Chloroquine.
Yeah, chloroquine. And basically the first responses were incorrect. And the person doing the prompts knew the answers were incorrect initially, and then asked the AI, "Why are you giving me incorrect answers?" And it says, "Oh, I'm doing my best. I'm still new, blah blah blah." And it kind of brings up the point, um, and we've talked about this before too, like, these biases that exist and how models, the output is only often as good as the input, because so if you have garbage in, you're going to get garbage out. So whoever's controlling the information that's going into these models and these AI systems is kind of is controlling what truth really is. Um, so the question becomes, how do we actually navigate in a world where there's misinformation all over and AI is getting so good? I mean, AI can almost, I mean, I've seen some of these videos recently where like people are like you see a person and like they're saying things that you don't think they would be saying, but they're saying, and like so there could be all this propaganda on both sides. Like, I don't know. Any ideas on this? How do we navigate this?
Yeah, I mean, well, one, I feel like it's exhausting because you have no idea. I feel like, yeah, it's like, how do you know what's true? Uh,
Hmm.
I don't have a good answer for you. I feel
Yeah.
like at the end of the day, you just kind of have to. I can only really say what I do, which is I try and look at evidence from both sides, and I try to come to a judgment of what I think is correct, and
Hmm.
I just go with that.
Yeah. I mean,
I
uh-huh.
don't, yeah, I don't really know what to say. Like, uh,
I don't know. I don't know that I have a good answer either. I mean, the quote, I think there's a quote, I don't know who said it, something to the effect like whoever controls the present controls the past, and whoever controls the past controls the present.
yeah, that's 1984. That's George Orwell.
Was that? Okay,
Yeah.
cool. Yeah, so it definitely made me think of that quote when I was reading that. Because you gotta, yeah, I mean, yeah. The narrative can change depending on like who's in power, who's calling the shots. Um, and it also made me think of Ray Dalio's quote, or not really a quote, but like a thought experiment that he said when he was wrong one time when he thought he was absolutely going to be right. And he said he doesn't ever really think that he's right anymore. He always asks, how do I know I'm right instead? So I think if people maybe just ask themselves that, maybe that's at least a step in the right direction to be a little more open-minded to the possibilities.
Right, being open to the idea that you're wrong, but like I feel like people have such a hard time with that. Like think some things are just so ingrained.
Hmm.
Uh, it's like how do you? I remember I used to be like this. People would bring up things to me that I kind of viewed as like dogma, like, and it's like no, of course this is right, and you kind of like at the end of the day, if you start doing some reading, you're like, well. Is it right? Am I right? I don't know.
Do you have an example of something you really changed your mind on?
The food stuff. I think I did change my mind on.
Like what part of the food stuff?
I think it is more. I think limiting, even though I don't really do it, I will say I felt a lot better when I was a vegetarian physically.
Hmm. Interesting.
I think eating more of a, I think the term is like frugivore diet,
Okay.
is better. But there are people that will say you should only eat meat,
Yeah. I
which is
mean,
why,
some,
like, I think at that point, it's just you should just do whatever, you should do whatever makes you feel good and just
right.
live your life.
Yeah. Yeah. I
I
think
mean,
I've
obviously,
heard,
there's some things where, that you can't do that, but
mhm. Yeah. I mean, I think I heard Jordan Peterson's daughter only
yeah,
eats
she's on the
steaks.
carnivore diet.
And like our dad has been instructed not to eat a lot of fiber. So he eats a lot of meat. Um, yeah, everyone's a little different. And I guess it gets to the point that people should be able to make their own decisions. Um,
I mean,
on
the
what
other thing
they,
is like, I mean, not to go like way off topic, but I mean, we had Yaron Brook on, and I feel like the Israel-Palestine thing, conflict comes up a lot to me. And I feel like I listen to these people that have studied this conflict for essentially their entire lives. And I feel like everything they're saying runs contrary to everything that I have read myself.
Hmm.
It's like you've essentially studied this conflict your entire life, and I just think you're so wrong.
Hmm.
And there are people that will, study it their entire life and agree with me. So it's like who's right?
Right. And I guess that's why this is like an actual like conflict because both sides have been so ingrained with the history. And I guess
Right.
this who controls the present controls the past. So and if each side is being fed different information or different views on the past, it's hard to it's hard to come to some agreement.
Right.
Um so okay, any ending thoughts?
So I actually did have she brings up a section where I just have pharmaceutical fines written down with a question mark on my notes. She brings up the section where she's listing out some of these companies and like the amounts of money they've had to pay
Uh-huh.
for essentially some of these side effects of their drugs.
Okay.
Uh, these fines, I don't know. Did you ever see the movie? I think it's called Dark Water.
Uh, Perhaps.
It was about when DuPont was putting it was like I think it was like it was like polyfluorinated like octanol or something. It was essentially whatever is the thing that makes it non-stick in your pans.
Okay.
Yeah, so like those are apparently you can't metabolize those and excrete them. So they were causing cancer in all these people.
Uh-huh.
They were polluting the water in this. They were essentially polluting the water in this like town. Um, and then at the end, this is a true story. At the end of the movie, they show the amount of fines that DuPont had to pay,
Mm-hmm.
and the amount of fines amounted to I don't know, maybe I don't remember the exact number, but it came out to be about like 1% of their sales. It's like so small. Like the fine is so small. It's like, do you think they even care? Like I
Mm-hmm.
feel like if you're going to have a fine, I mean, and yet again, like I don't think they're purposely trying to kill these people.
Mm-hmm.
I just think it's something that they discovered and they probably didn't know. Well, at least in the drug companies. In that
Mm-hmm.
movie, Dark Water, they at least in the movie presented evidence that DuPont did know that they would cause cancer.
Mm.
Uh, but my question is, if the fines are not great enough, do you think there is enough deterrent to really make sure people are doing their due diligence? Or is
Well,
it
no,
just
but I guess, yeah, it's kind of a tough situation because I kind of, and this is why there's a separate vaccine court, I guess, because it's, it's, well, I guess the vaccines are a little different, but yeah, it's like, do I have to think about every single thing that could go wrong using this product that I create? That's kind of tough to, but yeah, if you could show that, or at least when you say DuPont knew that this could happen and they were trying to keep it on the low, yeah, 1% doesn't sound like anything to deter them from doing anything,
I mean, at the end of the day, I don't think like I think they're trying to make actual drugs that help people. But if you have evidence that shows people are getting sick, you should scrap the program, or you should list in some cases, I think you should just list a warning and let people be informed that there's this potential for a side effect. And then they should have the ability to make the decision.
right.
I remember one of the first companies I ever bought stock in was a company called Ariad, and they were making a drug for cancer for a very like aggressive form of cancer where the people essentially if you had this cancer you were going to die in like 3 or 4 months.
Hmm.
and their drug got approved. And then later it was they were like talking about only prescribing it in like super rare cases because people that were taking it, there was a incidence rate where people would have some heart issues like a year after the fact. And I just
Hmm.
remember thinking, well, you know,
They were
if
going
you're
to
gonna
die in three
have
months.
if you're gonna have a heart issues a year after the fact, and not everyone that was having these, some people were.
Uh-huh.
In my opinion, that is a positive outcome from dying in 3 months. So
Hmm.
I don't understand. Like in that case, like I would just let people know, and if they want to take the drug, they can take the drug.
Hmm.
But if it's you're taking something for high blood pressure and it's going to damage your heart, yeah, you probably shouldn't be taking it.
Yeah. Yeah. Well, it'll be interesting what happens because it seems like, Kennedy Jr. has been appointed. So a lot of the stuff in this book might actually come true with some of these vaccine companies having to prove more or just be a little more transparent, I guess, in some of the side effects. And it'll be interesting to see what happens.
Always is.
Um, so with that said, please reach out to us at brothersonbooks@gmail.com for any book recommendations, or if you'd like to be a guest host for a particular book you have in mind. A great review or rating on whichever platform you're listening to this would be greatly appreciated. And lastly, if you can think of any friend, family member, or coworker that might like this episode, please pass it along. For the original episodes, the OGs, please visit brothersonbooks.com. I am Jack Allwild, and with me, as always, is my brother Alex Allwild. Al, what book are we reading next time?
We're doing Beyond Good and Evil by Nietzsche.
That's right. I'm like 10 pages in, Al. It's an intense read.
Well,
It'll
thankfully it's
be
not long.
what's that?
Thankfully it's not long.
Yeah, yeah. I will say I've liked a lot of the niche thought experiments that I've heard about in the past. I just hadn't read actually any of the source material. So yeah, we'll see what we can get from this. So
Okay.
okay, Al, until next time.
Until next time, Jack.